I'm going to start just by taking a look at the face and framing. Okay, I see some dryness and spots. We're going to see if we can add some moisturizing qualities to that. Okay? But I think I have a perfectly symmetric subject. So, which is what I want to see, I think. Okay, hold still. Okay, stay right there. Hold still. Right there, so the center of your face is right here. And that's where we'll start the process. I'm going to be just starting right along the head, down the center. Okay. Okay, that's perfect. That tells me exactly. Now I'm just going to be taking some notes about your facial structure. So I see first you have a very aquiline nose, which would be good for what I have framed here to do. Okay, top. Feel the pressure there. Good. Okay. Your eyes are walnut shaped, so that tells me that a nice cleansing powder right underneath the eye, yeah, will do wonders for you. Okay. And your head. Could you scrunch up your eyes? Raise your eyebrows as high as you can. Okay. Okay. I'm just seeing along the eyes here. Your brows. So I see we have some extra length on the left side. On the right side you do have a cowlick. But that can be polished. That can be polished and arranged. So I'll be doing that. Do you need any water? Anything to drink? Okay. Good. Alright. I'm going to be taking some measurements of the face and then doing some dotting just along the center here. But I do need to know, just for the photos, for the photographs, what we'll be framing here. Okay. Relax. Very good. Now I'm just doing right across from here. From the forehead to the bottom of the face. Okay, so that's supposed to be expected. Number 4.5. Okay. I'm just going to be measuring your nose. 1 inch. Exactly. Still a very thin prominence about your nose. Okay, just raising the thing. Tickle up here. Excellent. Okay, just going to be going down the sides of your left side here, from your forehead to the brow. 2 inches. That's good in the center. The center is 1.5, so it recedes in the middle. It does recede. Okay. And on your right side I see you have 3 inches again. Okay, how are you feeling? Alright, I'm not seeing anything dermatological to worry about. Just taking the measurements so I know exactly what to apply and where. 1.5, perfect. And right under your eyes. 1 inch. And 1. Okay. Now if you could just let your mouth open naturally, just like that. That is perfect. Along the side here. Perfect. Alright. I'm going to do have a slight natural smirk on your right side. It's very becoming. Okay, almost finished. Just getting the long length along the head. 6. Okay. 6, very good. Okay, just hold still. Just doing some inspections of the skin. I'm seeing excellent perforations. Nothing to worry about here. Giving up. Okay, stop. Because you just try not to move your face. Just stay still. Very good, it's important. Very good. Alright. Little dryness on the corresponding patches of the nose. I see. Going to the other side now. Okay. Alright. So, more moisture there on this side. Just going down here. Okay. Alright. Is the light hurting you? I'm so sorry. You can close your eyes. Yes. Go ahead and keep your eyes closed. Very good. Okay. Okay. Just going to be dotting here. Just dotting here. Just along the stick area. So this should feel like a scratching sensation. It's just for me to gauge if your pores are flush with the skin, and if your pores are enlarged, we will apply a treatment with hyaluronic acid that will help you to shrink those pores and moisturize the skin. Okay, so just hold still. Hold still for me. Okay. Not too much moisture here, so that's good. Just stay still here. You're doing so good. But I just need to... I'm sort of a perfectionist, so bear with me here. You just have to look perfect for your photographs. Okay. Alright. This is just to test the moisture and sweat barriers right here along the sides of your cheeks. So just stay still. Stay still for me, okay? Stay still. Don't move. Very good. Very good. I'm going to be checking here. So you're not a sweaty person. Okay. And you don't have a lot of dirt or debris, so we don't have to apply a cleanser. I'm just going to start with the treatment. Okay. Does this feel like a scratching? Oh, good. In a good way, okay. Just hitting right along your right side. Okay, and we'll be doing some more treatments then. Just hold still. Next I'll be doing some palpating. I just need to feel that it's perfect here. Okay, and down to 2 inches. That's a little bit out of symmetry. That has some pores that are sticking out, so I'll keep that in mind. Going along the side of the face, I'm just smoothing out the work here. Okay. Right. Good. Your sinuses are slightly swollen. No severe edema, but it is something. Does it happen in the morning? Okay. When this happens, do you drink coffee? Okay. I would drink just a bit more water in the morning just to prevent that slight bit of swelling that I'm seeing underneath the eyes. A lot of that is natural though. It's not going to go away, so you're not doing anything too terribly wrong. Just checking the cheeks, checking. I will be applying a bit of cold pressure therapy to the sinus cavities under here, and then we'll continue with the framing. Okay, now your posture has drooped a bit, so if you could stand up more straight. Good. Okay, now pretend that there's an imaginary string holding you up. That perfect. So whenever I say to stand up straight, lots of my clients tend to do this, tend to try to compensate by bringing their chin up, and it looks very, very awkward. So we want to start from the base of the skull and just let gravity do its work, lifting ourselves up. Very good. So just like what you're doing now. Excellent. Okay. Alright, if you could turn your face to the side, just this way. Okay. Alright, I'm just seeing a bit of flicks that I need to smooth out there. Very good. On the other side here. I'm just seeing a bit of plucking. Okay. Okay, turn your head. Very good. Your cheekbones are prominent, which is very in style now, so that will bode well with the photographs. Okay, turn your head this way. Perfect. Going to be looking along here, along the chin. Okay. Now this cheekbone is a bit less prominent, but you have almost perfect symmetry. Nobody has perfect symmetry, so not to worry. Okay. You can bring your head back to center. Now, remember to keep your right. Take some work in the beginning, but if you make it a daily practice, it will do such good for your spine and make you look more like a confident person. So we all need a little bit of confidence throughout the day. Alright, I'm going to be bringing the cold treatment, so just stay where you are. I'll be right back. It's in my medical refrigerator. Treating it again. Hold still now. Okay. I'm seeing it already begin to smooth out. Smoothing out those sinuses. You look so much more awake now already. Okay. Now I'm going to be dotting along the sides of your face. Stay still, please. Alright, good. Do not move your face if you can. If you absolutely need to, go ahead. But it will help if you stay still for this, okay? Just going down the centers of the sides. Good. Okay. Okay. Do you feel a cool sensation? It's cold, yes. Very good. Okay. I'm going to be bringing it to the center, right on your chin here. Okay, so that should feel much better. Back to your sinuses. You don't need to do anything now. Just relax. I've got it. Now I have to ask, do you feel the cold equally on both sides of your face, or is one side more sensitive than the other? Okay, good. Okay. Okay, so now I'll be dotting and mapping along the face. Just hold still. It's right here. Okay, good. Okay. Okay, very good. Right along the sides. I'm not going right underneath the eye because I don't want to damage that sensitive folds of skin. However, along the cheeks, so if I apply the right amount of pressure, which is what I'm trying to do, the blood circulation will travel up and down, but especially here to relieve that puffiness. In addition to the cold therapy, I think that's really going to help you. It's already looking so much better. I wish I could show you a mirror. But okay, very good. Just going to be okay. That's perfect. Yeah, and down. Okay. You're going to feel a slight pinching now. Okay. If I know your level of where your face tends to carry its body fat, we all have it in our faces, I can determine where to focus on in terms of the pressure point therapy and the sensations exams. So there you go. Okay. I'm going to feel a slight pinching. Don't flinch. I'm not going to hurt you. Perfect. Okay. Okay. Alright, I'm going to dot there. Okay. Okay. Along the forehead. There's less fat on the forehead. Usually it comes down to the cheeks and to the lower jowls. Not the best flattering way to say it, but right along the jawline is where I'm trying to pinch, just to get a gauge of where your face tends to hide its fleshiness. You're doing so well. Okay. Do you need anything? Any water? A food? A cup of tea? Okay. Yes, sir, as you've noticed, I'm wearing my white strips now. Just need to get this right spot right here. I'm going to be dotting, so you're going to feel the pinching and a slight pressure. Very good. Any pain there? No. That's a proper good cheekbone here you have. I notice the prominent point of it. I'm going to be dotting it. Dot, dot, dot. Dot, dot, dot. Dot, 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 dot. Very good. So I'm already seeing the blood circulation so much more. Before you had a lot of redness around the eye. Now it's descended into the cheek area where we normally associate with a healthy person, with a healthy face. So you're looking like a much more healthy person. Okay, so just going to be pinching and squeezing again on this side. There you go. Perfect. So when you move on to the makeup artist coming in, she's going to compliment you on your perforated skin, especially right here. Your cheeks are rosy without even having blush. It's quite wonderful to see. Yes. So I'm just going to be feeling here. No moisture, so the excess sweating has gone away. Okay, so still. So this first treatment is a botanical based serum. It's composed of hibiscus and squalene oil. Just going to go lightly on your cheeks. I'm deciding to spend a lot of attention on your cheeks because they do look rosy. You have those prominent cheekbones and it really is the highlight of your face. So we should take our best features and really highlight them. So that's what we're doing here. Very good. Okay. This is definitely a full roller that's going to smooth it out even more. Okay, so you're going to feel it. I'm going to apply it to the top of your head. Okay, so that's going to really improve the sensitivities along the hairline. I see no redness here, but this will be good for you, so just hold still. Just wiping along the very tops of the face. Excellent. Does it feel good? Does it feel like a massage? Good. Okay. Whoops. Sorry, didn't mean to do that. Okay. Alright, I'm going to take off my white strips now. I think it's about time. Pardon me, I'll probably cut this from the video unless it makes an interesting sound. Okay, so that's the first one. Not too professional of me, is it? Oh dear, don't tell my superiors. But now my teeth are much whiter, you see. I can send you home with a few that I have in my personal collection. Okay, so just smoothing you out. Does that feel cold or warm? Actually, a mix of both. Mix of both, yeah. The music has started outside. It is a Friday or Saturday. Okay. Your pores have shrunk. So pleased to see this. Some of the treatments I'm applying today are experimental. They've been approved by the FDA, of course, but I've never used them before, so very, very interested this year in using more natural ingredients, so that's the direction I'm going in. Okay, natural occurring peptides that help your skin just be at its best without those nasty chemicals, things that we don't want. Okay. Alright, very good. Some of your hair is falling down on your face, making it hard for me to work along the hairline, so I'm just going to be doing some brushing just very lightly. Excellent. How do you feel? More awake? There's a guitar player downstairs. The top floor is a clinic, but below us there are some flats with a few musicians that I personally like to listen to, but some people think they can be distracting. Okay, now hold still. I see now that you're slouching. See, and this is the problem when we are so ingrained to hold a improper posture, we don't keep with it. We're never told to stand straight, lead from the base of the skull. Good. So much better. You're looking so much better without even the makeup. You might not even need makeup today. How's that sound? Just a little bit of eyelash serum and you might be sent on your way, but that's not for me to decide. That's for your makeup artist. It'll be here shortly. Okay. So the next oil we have here is a little bit more heavy. you're going to feel it. It's a non-greasy formula, but it's potent, it works. It's a lot more heavy and strong than the one I just applied. Do you feel it? Good, just stay still now. Okay, so we'll be wiping your sides. Good. Good. You feel a little bit more warm, which is lovely to see. So this has brightening ingredients such as vitamin C and minerals. Most exfoliants can scrape away at that skin barrier and strip our face of their natural oils, so that's what I'm trying to keep from happening to you. You don't need that. Okay, perfect, perfect. Okay, I'm going to be sliding down right underneath the sinal cavities. Wonderful. And smearing out. So according to the facial measurements I made, this treatment really is the best. It gives you that glow to your cheeks. Very good. Okay, now don't be worried about this. Patting along the face. There's very minimal oils. So we're keeping what needs to be kept and blotting the skin of slight microscopic greasiness. There you go. Does it tickle? Sorry about that. We're almost finished. Okay. Okay, now hold still. Okay. I'm seeing just excellent radiance about the skin, so very good. Radiant. Alright, now, since the oils and serum I used are quite new to me, I want to make sure that they're not numbing your face. You should feel a cold sensation, you should feel tingling, but no numbing. Numbing would be a sign that you might have to go to the hospital or the doctor, but I don't think that that's the case. We are going to check and make sure, okay? Do you feel them at all? No? Good. So this will be, we'll call it a sharp sensation. This will be soft, okay? So say sharp or soft. Okay, close your eyes. Very good. Getting right beneath the eyebrows here, just dotting. Does that feel sharp? Good. Do you feel it equally as I slide it from the tip of your brow to the end? Good. Okay, now this feels sharp or soft? Soft, good. Okay, how does this feel? Excellent. Okay, and this? Very good. Sharp or soft? Good. You're doing so well. Sharp or soft? Okay. Good. Good. Sharp. Nice. Okay. I really want to stress to drink lots of water, especially after this treatment, because you want to keep the effects that I'm applying for as long as you can, or come back to see me every day, which I don't know if that's in your budget, but we'll see. Okay, just some blotting paper, just to leave you with an application of strictly mineral treatment to your face. So that's what we're doing. So I want you to go ahead and look straight ahead at me. Okay. Alright, this paper is hypoallergenic, so there's no scientific possibility that you would develop an allergic reaction. So don't worry about that. It just contains minerals and essences that are perfect for the skin. Perfect. Okay. Okay, I'm just going to put it right against your nose. Hold that there. Okay, I'm going to be just framing here. Okay, you are ready for your makeup. I'm so pleased with what I'm seeing. So that's perfect. Okay, look at me. Now, just for your photos, if you could pull yourself up, just like that, yes. Slightly tuck your chin in, okay. And if you get to a point where you're not making progress, look away from the camera for 5 seconds, maybe 10, okay, and then start fresh. Alright, because sometimes we make so many facial expressions into the camera that things start to feel artificial, mechanical, and that's not what you want. You want to have a natural capture of yourself and your feelings and your essence and your personality. Yes, so that's a trick I've learned. And you want different angles, and the photographer will go over this with you, but there are times to tuck in your face, okay, like that. And then certain angles, certain dramatic angles, you want to lift your chin, but never lean like this, never lead with your chin. So you might want to tilt your chin like that, but always lead from your core, just like that. You look so perfect. I am so obsessed with your skin. It looks so good. So I'm going to send you on your way, alright? So I wish you the best photography session, and my pleasure. Alright, okay, so the door's that way. We'll see you again here soon. Bye.